Thank you. Again, my name is Jen. I am a podiatry resident at Wake Forest Baptist in Winston-Salem. And I spent the last year kind of helping to build a comprehensive tobacco cessation program for our foot and ankle surgery patients. So tobacco use is a global issue with over 1 billion people worldwide using it. There's over 400,000 deaths responsible annually due to cigarette-related complications. This costs our healthcare systems nearly $4 billion. About 1/3 of US high school students have reported the use of electronic cigarettes, and that's about the same in the state of North Carolina as well. So why does this affect, my practice personally? Well, we operate on patients, and post-operative recovery does require an increased need of oxygen, and tobacco and nicotine use does decrease that availability. So just a brief overview of cigarettes. There's 4 main components. The smoke, which is inhaled, that can cause delayed bone healing, and it also inhibits factors that encourage the growth of blood vessels. Hydrogen cyanide is a byproduct of smoke and inhibits metabolism at the cellular level. Carbon monoxide, another byproduct, binds hemoglobin at a much greater affinity than oxygen, and so that puts our bodies in a hypoxemic state. And finally, nicotine, which is found in tobacco products, is a vasoconstrictor and also inhibits collagen production. Smokeless tobacco, also very common, especially in North Carolina. It has many known carcinogens. About 30 minutes of chewing tobacco provides as much nicotine as 3 to 4 cigarettes. This suppresses our immune cells, causes inflammation, and interestingly, there are studies show that even chewing tobacco can negatively affect post-operative outcomes. Electronic cigarettes have become more popular in recent years, and the 3 main components are a power source, like a battery, which heats up a coil and causes this liquid to vaporize, and that is what is inhaled. And there is no combustion to this, so there is a misconception that this isn't harmful, but that is not the case. Much like cigarettes, this is cytotoxic, causes DNA damage and cell death. Again, causes inflammation, puts our cells in oxidative stress, and can impair our microbial defense systems. And there's an interesting study that shows that MRSA, when exposed to electronic cigarette vapors and macrophages, lives longer than when macrophages were exposed to just room air. So all this science and background, why does it matter? Why does it matter to me as a podiatrist? Why does it matter to all of us as healthcare professionals? Well, due to the history of North Carolina, there's a lot of tobacco use here, whether smoking or non-smoking. And we know that this causes bone healing complications. This increases our wound healing time. And actually, more recent studies show that there's worse post-operative pain in our patients who use tobacco products. We also know that, at least in foot and ankle literature, that 6 weeks of smoking cessation prior to surgery improves outcomes and decreases the risk of complications. There's also research that shows that comprehensive smoking cessation programs through pharmacotherapy, through in-person appointments, access to quit lines, and educational handouts is actually pretty beneficial and effective in tobacco cessation. So as a resident, I go to a lot of different clinics. I'm in a lot of different operating rooms, and I've noticed that we have a lot of patients who use tobacco products, but I feel like we're not offering enough to help them stop smoking. And so I did some digging. I'm at a large academic medical center, and I found that we actually do have a tobacco cessation clinic, and the target population is pretty restricted to just oncology patients. And the goals of this clinic are individualized treatment plans, close follow-up, and ongoing support. And I thought, what would be a good way to get my patients to improve their post-operative outcomes, decrease complications on our end, and I thought maybe we can collaborate with the already established clinic, but kind of tailor it toward my patients and the patients that we see, and maybe open and expand to our podiatry patients. So through a lot of collaboration and meetings and seeing if this is even feasible with the manpower, we were able to start this project. And so my three main goals of this project were to expand the clinic, be able to integrate our patients into the clinic and our health system, establish a referral system that is efficient, and I say that because we are all busy. We have a million things to do, a lot of patients to see, and if this is something that's complicated, it's not as likely to be picked up. So establish a referral system, and lastly, track the progress of how we're doing. And so fortunately, we were able to open this up, and this is feasible for our patients. And so what it would look like is on our end, if we have a patient who is wanting surgery, but they're using tobacco products, interested in quitting, they would receive a referral from us. They would be contacted by a tobacco cessation navigator, is what we call them at the clinic. The patient would be called and interviewed. About a 10 to 15 minute survey would be completed, and this includes things such as their tobacco use history, what they use, have they tried to quit before, and how serious are they about quitting. And the end of the phone call would include an appointment confirmation, and fortunately we have virtual options as well. This is an example of the survey that our patients are able to, that are completed when our tobacco navigators contact the patients. Again, just a history about their habits. After their first appointment, patients are followed at the 1 month, 6 month, and 12 month mark, and there's surveys that are used to track their progress. This is a survey that we use here. It's a lot more expedited, and it's shorter, and it just asks how they're doing, how important do they feel that stopping smoking is or tobacco use is for them, and what resources have they used so far. So this is what our patients will be contacted about at the 1, 6, and 12 month mark. So all of that kind of compressed into a few minutes. We did have a couple challenges along the way, and they're still working through them. Our electronic health record systems are being integrated. We are in the process of integrating with another health system, and with that comes some delays in being able to establish orders and referral bases. And so if things aren't easy, sometimes it's hard to catch on with multiple providers. Survey completions. Some patients just don't want to complete surveys. They don't want to answer the phone, and so compliance with that may be a challenge. But lastly, I think the biggest one is patient and provider buy-in. Patients especially, I've found that they feel like they don't need a program to stop smoking, and a lot of them have responded that they can just do it by themselves. However, I'm confident that by continuing to educate both providers and patients that we'll be able to get this program up and running, and I think it truly will make a difference in our patients' lives and our post-operative outcomes. So looking forward, I hope to continue to build and expand this program that we've laid the foundation for. We're going to continue to track the progress of our patients because we don't know how we're doing unless we know how our patients are doing. And lastly, just continue to educate, like I said before, our patients and providers about the benefits of not only just fixing our patients' feet, but this is something that can be an entryway into them living an overall healthier life. So thank you.